Welcome to Global Development Interrupted. I am Leah Petit. And if you have ever wondered what global development really did for people abroad and here in the United States, then you are in the right place. With each episode, I talk with someone who is working behind the scenes to ensure the world and the United States was a healthier, safer, and more prosperous place to live. We hear about what they did, why it mattered, and what's at stake now that the United States government has dismantled USAID and taken a huge step back from global assistance. For this episode, I am very excited to introduce you to Ashna Kibria. Why? Well, because with each conversation that I've had on this podcast, one theme continues to emerge: growing concern about pandemics and the vital role USAID had in preventing them. Ashna? She has a unique perspective because she was a senior public health advisor in USAID's Office of Infectious Disease Emerging Threats Division, where she managed global health security programs in more than 50 countries, as well as supported country teams with outbreak response and program design. So let's go meet Ashna. Hi, Ashna. Welcome to Global Development Interrupted.
Hi, Leah. It's great to be here.
We are going to start with I would like your full name, because I always butcher names, so please give your full name. And then
Ashna Kibria. You got it right.
Okay, perfect. And where are you calling in from?
I am calling in from the greater Washington, D.C. area. Still in the D.C. area.
Awesome. I love to hear it. Love D.C., even though it has a bad rap right now.
It does. What's going on here?
What's going on? Yes. What was your former title at USAID?
So I was a senior public health advisor. I was at USAID for 10 years, so my title changed a lot. But most recently, I was a senior public health advisor at AID.
Great. So we are going to get into that. But before we get into what you did at USAID, let us know, what was your go-to fun fact?
Oh my gosh. Gotta have a fun fact. Today, I think instead of a fun fact, I'll try and share a fun story with you. My favorite fun story from USAID. So a few years ago, it was my first trip to Kigali, Rwanda. It was my first time in the cities. I was trying to get to, know a little more about the history, and we got out of work early one day, decided to stop by the Genocide Memorial. And as we're going through these very somber rooms and learning more about the history, I literally hear what I think is the voice of God. And just walking down the hall, I see that it's Morgan Freeman just walking down the hall towards me. And I kid you not, he's iconic, he's legendary, right?
Yeah. Well, he was the voice of God.
He was the voice of God. So that's what I mean. I'm like, where is this voice coming from? And it was Morgan Freeman in Kigali, Rwanda. I think he was in town filming a documentary or something. But I always love to share that because, our work is so serious and we're doing these serious things every day. But I also love, how USA tends to surprise us sometimes. Reminds us that the world is a small place, and you run into Morgan Freeman in Kigali, Rwanda.
All right. So Ashna, where did you grow up and what led you into development?
I was born in Dhaka, which is the capital of Bangladesh. And then when I was almost 7 years old, my family actually relocated to Harare, Zimbabwe, which is, it's a big jump from Bangladesh to Zimbabwe. But we moved there because of my dad's job. He's an architect, and he was supporting a lot of public construction projects in Zimbabwe, designing hospitals and healthcare facilities, both in Harare and outside and around the country. Growing up, I spent time in Bangladesh, which obviously influenced my worldview. And then while in Zimbabwe, because of my dad's job, I actually had the opportunity to sometimes join him on side visits. And my parents are generally adventurous people. So even back in the day, they used to love road trips. So we took a lot of road trips around Zimbabwe, around South Africa and the region. And once you leave the city, because I grew up in these large urban cities, which is both Dhaka and Harare are these urban centers. But once you leave the city, you start to see more of how a vast majority of the country live. I think those early experiences really informed my idea of equity or inequity. That's sort of originally what led me to think about working in an area where I can help people and make a difference.
You were at USAID for over 10 years. What was the last job that you held, and what were you doing and explain it in a way that you would explain it to like friends or family.
Sure. I will try to avoid all the government speak. So, I wore a couple of different hats on our team at that point, around the time the agency ended. The first hat is that I was a senior program manager, which essentially means I was certified to manage complex federally funded awards. I managed one of our flagship projects with private sector that was looking at mitigating risk of emerging diseases, mitigating antimicrobial resistance. And I also co-managed and was part of the management team for our other flagship award with the UN Food and Agriculture Organization, which was active in 50 countries. So huge global awards that I was managing. The other hat I would say is as a technical advisor for our missions in each of these countries. I primarily supported our missions in East and Central Africa, as well as our missions in South Asia. But essentially, that means supporting the country with any and every challenge that they may have regarding global health security. If there is an outbreak, supporting outbreaks in those countries as part of a response team. If there is a need to design a new project or a new activity, you provide that technical expertise to design a new activity.
Let's talk about what that umbrella is, health security, because you had mentioned you were working for global health security, and this is something that evolved in 2014 in response to the Ebola outbreak.
So you're correct. The West Africa Ebola outbreak started in 2014, I believe. GHSA was also launched in 2014 directly following that West Africa Ebola outbreak, which claimed more than 11,000 lives. And it was a real scare, I think, for everybody around the world. So the Global Health Security Agenda is a global partnership. It was launched by the U.S. in partnership with 17 countries around the world. And the goal of GHSA is to prevent, detect, and respond to infectious disease outbreaks. For our program, we were primarily focused on emerging or novel diseases that are zoonotic, which means that the diseases originate in animal populations and may spill over into humans or are transmitted between animals and humans. A good example of that would be Ebola. A good example of that would be avian influenza, which is more commonly known as bird flu, and actually even COVID-19. All of these are considered zoonotic in origin, meaning have originated in animals. USAID's work is quite unique in that we recognize that the health of humans is interconnected to animal health as well as our broader ecosystems. As a development agency, we were uniquely making investments not just in the public health sector, but we were making investments to bolster the animal health sector, the environmental health sector in each of the countries where we were working. So when I talk about bolstering capacities or strengthening capacities under the Global Health Security Agenda, what I really mean by that is a holistic systems-wide approach, supporting our partner countries to ensure that they have a strong disease surveillance system, ensuring that each of these countries have adequate laboratories where laboratories have both people as well as supplies to be able to carry out tests and detect these diseases. That's really critical to ensure that if there is a disease outbreak happening, that is actually tested and diagnosed. And in the 10 years that I worked at USAID, so I mentioned that in 2014 it was the US and I think 17 countries. I might be getting that wrong. But in 2025, the partnership is more than 70 countries. So that just tells you how much a lot of countries are really taking their health security very seriously. But I do want to flag the scale of our program. At the time that USAID was unfortunately dismantled was massive.
Well, and I just recently, I don't know if she continues to be the CDC director, but when she was testifying in front of Congress, she said the US is not ready for the next outbreak, which is incredible when you think, yeah, the next pandemic. It's incredible to think of all the investments that we put towards preparation within USA to keep us safer. And now, just even domestically, we
Yeah.
are not prepared.
Yeah, because I think the other thing to remember is that um, this work takes commitment. It's not just a one-time investment. You have to continuously ensure that disease surveillance systems are active, in place, they're strong, that personnel are trained, that you have access to the resources that you need, that there's access to personal protective equipment. that, adequate risk communication mechanisms are in place. And all of those systems have to actually function. So if we slide back in one area, well, that affects the entire overall security of the country.
Yeah. I mean, when you talked about personal protective equipment, I remember COVID-19, everyone was freaked out because they couldn't get masks,
Yeah.
and healthcare workers couldn't get the appropriate masks
Yeah, and
either.
that was one of the major contributions USAID made during that time as well. By the way, that USAID has always maintained global stockpiles of PPE. So during the COVID-19 pandemic, because we had the stockpiles, we were able to send it out to the most high risk, or the places we consider to be most high risk, where they made a request.
Ugh, such a loss. I was wondering though, as you were talking, did you see Ebola outbreaks crop up again? And was the response swifter with this focus?
Yes, lots of Ebola outbreaks have popped up. It's not uncommon. In fact, at the moment, as we speak, the Democratic Republic of Congo is experiencing its 16th Ebola outbreak. During my time, I was able to support more than one Ebola outbreak response in the DRC. So back in, I believe in 2022, there was an Ebola outbreak in Eastern DRC, which was particularly complex because the outbreak was also happening in a conflict zone. So I took part in the Bureau for Humanitarian Assistance response management team to support that response on the ground. At the time, USAID provided really critical additional support. So our partners on the ground, depending on what their needs are, we might support infection prevention and control. We might support contact tracing and surveillance. The current, outbreak that's happening in DRC, obviously, USAID is no longer there. So this information I'm sharing is absolutely based on information we're finding in public sources. But my understanding today is that, they are experiencing significant challenges with their outbreak response. This particular outbreak happened in Kasai, which is a really remote, hard to reach part of DRC. And one of the gaps they've mentioned is a gap in contact tracing and surveillance. We have also heard, and through public sources, that perhaps safe and dignified burials are not being carried out. That is extremely important during an Ebola outbreak to ensure that the burial process is not just the standard burial process, but certain additional steps are taken to ensure that that Ebola outbreak does not spread further to others who might attend the funeral or other folks. That's how it ends up spreading, person-to-person contact. So we have heard that there have been significant challenges with this particular outbreak. As it stands, infectious diseases do not recognize any borders, and they don't stop because USAID has been dismantled. But we are hearing that there are significant challenges, and it's, I think if our team was here right now, that this is something we would have stood up a response team for and been in regular contact with our teams on the ground, working in close collaboration with USCDC, with our Ministry of Health colleagues, to be able to augment the government's response and to work very closely with our international partners in the region.
And I think what you said here too is that you're augmenting the national country's response. This
Yes.
isn't charity.
Absolutely not.
This is how are we investing in a country to ensure that they can keep their citizens safer and keep us safer.
We are first and foremost ensuring that the outbreak is contained, that people in the Democratic Republic of Congo, particularly in that region, that they're not losing their lives needlessly and the outbreak is not spreading to new regions. But keep in mind, when we do that, when we stop an outbreak in DRC, we are also stopping that outbreak from coming back to the US. So global health security really is national security. Not only are we responding to outbreaks when they happen, that we are laying the infrastructure in advance to ensure that all of those capabilities are in place to be able to detect early, to be able to diagnose early. All of the prevention mechanisms are also in place. Like that part is also really important. It can't just be us being reactive every time we hear there's an outbreak. Because by the way, that costs a lot more. It's a lot more expensive to, pull all of our resources together, respond to an outbreak than it is to just invest in prevention. And what do I mean by prevention? I mean like education and training.
And I was just thinking of an example of that with South Africa. There was a lot of investment that went to South Africa for HIV, and they have surveillance systems. They're incredible research foundation, research institutes, great workforce, very innovative. And then with COVID-19, they were incredibly helpful in that
That's
identification
right.
and the research on the disease for the world.
Yeah, absolutely. And that's the other thing. And that's a really, really important point, right? I think often we think of aid as being one directional, but it's not. I mean, I think it's truly a global partnership in that, yes, in these instances, we are bolstering other countries and augmenting their capabilities. But something like the global COVID-19 pandemic is a perfect example of where we also got intelligence from South Africa back to us in a way that allowed us to prepare further. So I think it is really important for folks to understand that the US is just one player in this. So when we think about our national security, part of that is recognizing that we do need to think about infectious disease outbreaks in other countries because they won't stop because we have a border, that
Yeah.
diseases do spread.
And we need to think about investments as investments in partnerships.
Yes,
I mean,
absolutely.
I think again too of the Marshall Plan. You know, we invested in Europe because we saw also partnership opportunities and
Yeah.
economic growth in all of us being strong together. We're investing in this case with infectious disease in other countries because our partnership is stronger and able to tackle those diseases so that people don't die.
And that's a really nice segue into discussing our partnerships with our private sector partners. So, recognizing a few years ago that the private sector also has skin in the game because when disease outbreaks happen, it doesn't just take lives, it also takes livelihoods. There's very significant economic impact. And depending on the industry, so for example, if you're thinking about farmers and there is a animal disease outbreak on a farm, whether it's brucellosis or avian influenza, it wipes out the stock. The entire flock is gone, and that severely affects that individual farmer. When we think about it on a larger scale, the private sector absolutely, has an interest in ensuring that disease outbreaks are also mitigated. So a few years ago, we actively engaged private sector and we designed a new project, which was a true partnership in that USAID put in resources, but the private sector also brought in significant in-kind contributions. And the partnership was called Transform. I won't name all of the private sector companies that were involved. If you're interested, you can look it up. It was a really fantastic project because a part of what our interest was is, as government, we're able to provide the convening power, that diplomatic entry point into emerging markets. But as the private sector, they have certain technical expertise, certain efficiencies that we really wanted to tap into. So we actually really came together in a true partnership, co-designed a project that was looking at ways to address emerging infectious diseases and antimicrobial resistance. It's a really unique and novel approach that USAID had taken. The project sadly was in year 4 of 5 when the overall agency shut down its efforts, but it was already making significant progress. And there are fantastic success stories that if we had been able to complete the project, could have been scaled up to other countries. In the short amount
And
of
so
time, yeah, go ahead.
you talked about emerging disease for this project as well as
Microbial resistance.
antimicrobial resistance. Why is antimicrobial resistance important?
Well, I think that AMR might end up being the next global pandemic. So, this overuse and misuse of antibiotics is leading to resistance in our bodies. And, AMR related deaths at this point, I know I don't have the exact stats, but I believe it's about more than 4 million deaths annually due to AMR.
And you were saying the private sector is interested in
Yeah.
this space. And I would think, and I don't know, I was not part of any of this planning, but one, because if they're producing antibiotics and they're no longer effective, it's no longer a moneymaker. And two, if they have a new antibiotic, they have an immediate profit because they have something now that they can, produce globally for everyone.
Yeah, that's a great point. The other angle to consider for our program is Just going back to my earlier point, is it is a truly One Health program. So we were also thinking about AMR as originating from the animal health sector. So actually, during livestock production, large scale intensive production, there can be overuse or misuse of antibiotics, either as a growth promotant, either to preemptively treat diseases. Doesn't happen everywhere, of course, but does happen in many countries. So part of the reason for us to focus in on the animal health sector is we thought, okay, well, it might be an opportunity to work with our private sector partners to come up with a project where we are working with farmers and agricultural value chain stakeholders to think through how do we better train folks to carry out better biosecurity practices so that, one, it reduces the diseases on their farms, there's lower risk of disease, and there's a lower need for antimicrobials on the farm.
What was your favorite success story from that project?
I think one of the things from the Transform project that we would say is particularly successful is that out of all of the farmers we were working with, 80% adopted better biosecurity practices, and 50% of those and all of those farmers reported there were about 50% reduction in animal mortality. One of the other things that were reported by the farmers is also increased income because, of course, they had fewer outbreaks on their farms. I believe, outbreaks were reduced by something like 50% because of the adoption of better biosecurity practices. And that also naturally leads to increased productivity on the farm as well. So this project was not just about, reducing disease, which of course is one element of it, but it's also about improving farmer livelihoods. It's also about bolstering, business in other countries. So a lot of times we don't like to speak about it that way, but us American private sector taking part in these development projects also opens doors, and it creates a pathway to introduce new products and services and technologies in other countries where they might not have a foothold before. Also worked with local research institutions and local academia. So completed, I believe, 13 research studies and really built up that research capability as well.
Right. I think often people forget that business is about who you know and who you're networking with. And you can't just enter an emerging market in a new country without knowing who the key players are that you need to talk to. And USAID was a nice conduit for that.
Yeah, absolutely. I think, a lot of times we forget the three Ds like development, diplomacy, and defense. And USAID plays a really key role in that soft power and that development piece. So, we are, of course, there to support other countries and advance our development objectives, but we are very much part of the diplomatic community and we are advancing American interest. And that does include American business interests. So, by working with American private sector companies and introducing them to some of these new countries, they are able to get a foothold in if they didn't already have it, or if they have it, then this is a nice way to kind of expand their business or expand their market share in that country as well.
And how much was that project?
Like budget wise? So it was a $33 million project split over 5 years. As I mentioned, the private sector entities themselves brought significant in-kind contributions. So I mentioned, the research studies that were completed. A lot of the research was done with their own staff. Let's say we're putting 33 million, private sector might be bringing 3 times as much actually in-kind resources, just because they already have staff in place, just because it also furthers their business interest. And so, in that way, it is a true net gain for the US government to engage private sector as well.
And how does the involvement, because I can see someone be saying, well, why didn't the private sector just do it by itself in the first place? What is the role of USAID there and how is it helpful?
Yeah, I think that's where, the convening power of USAID. USAID occupies this really interesting space where we are able to work very directly in close partnership with governments. So this is not relevant for this project, but I will say in other scenarios, there could be instances where it's really difficult for an American company to get the regulatory approvals they need in a new country, that they don't already have relationships with the government, or they do have some relationships, but they're not getting their approval. So that's where having access to a development agency like USAID, which comes with its own relationships with the government, can actually make things smoother for the private sector. So it's not that they couldn't do the work alone. And in fact, I will tell you that even in the absence of US aid funding, our intent had always been to design the type of project where it can be sustained without US aid funding. So that was our intent in working with private sector, right? Is that USAID would provide that initial seed funding, but the private sector, once we have that proof of concept, would continue the work because it benefits their business as well. So in this particular scenario, farmers, once they realize, okay, hey, like doing XYZ biosecurity practices means like I don't have disease outbreaks on my farm. I'm oversimplifying. I don't have disease outbreaks on my farm. I don't need to spend money on antimicrobials. I do have increased income. Will continue to do that, because it benefits their business. There are lots of poultry association and poultry companies around the world that have signed on to our AMR stewardship principles because they realize, okay, this is actually good for business. When I mark my poultry products as antibiotic free, I can actually sell it for a higher cost, and there is a market for it. So there are small things where, private sector may not want to take that risk initially, but once you do a small pilot and you show, hey, it's working in this small region, can we consider scaling it up? Well, that's where private sector can pick it up and run with it. And that's where, USA plays that really critical role of providing that initial seed funding to carry out research, to carry out proof of concept. Once that's in place, it just continues on its own. So my hope is that, going forward, private sector entities will step in a little bit to address some of the gaps that have been created right now.
But it's also that our voice, the US government, the voice of American people, will not be involved in those conversations.
No, and I think that's the sad reality I think we're all grappling with is, very unfortunately, I don't know that, I don't think we can go back again. I don't know. I'd love to hear your thoughts, but once this gap has been created, our entire agency has been dismantled. Staff have been dispersed all over the place. And I think the biggest tragedy is all of the work that we did over the last 50, 60 years, all of the documents, that repository is also gone. So it's that loss of institutional knowledge that I don't know that we are going to get back anytime soon. And so I don't want it to be so glum and drum. Like, I hope we can turn the conversation around. But the unfortunate reality is I don't know that the US government will be part of that dialogue or have the seat at the table.
Yeah, I know. I think about this a lot. And one of the themes that has come up consistently as I've interviewed different people is the loss of trust. I mean, when you were talking about engaging with the private sector, the US had a credibility in those countries. They had trust built through different partnerships with different entities in those countries that then would be easily used to introduce them to other actors, whether those be private sector or even just engaging with global entities. And that trust has been broken. And so that's something that I think building that back up will be incredibly difficult and a very long process, because it's very easy to swing the hammer and destroy, but it's harder to build. I do agree, though, with what you're also saying, as this is an opportunity for others to step in and see sort of what the partnership and collaboration look like in terms of, I mean, global development was never perfect. And I don't think anyone would say it was. And so here's an opportunity for people to think about how to rethink what the systems look like. I'm just sad that the US won't be part of that discussion in the short term. And I hope that we have a role to play in the long term.
Yeah, absolutely. And I think it's worth acknowledging. And I think we all do, even internally at USAID, acknowledge that some of this donor driven model in some cases was never perfect. It absolutely needed reform. And I think we ourselves acknowledge that. But the way to reform isn't to stop all of the work or break everything. It is to reform, to rethink the aspects that aren't working well and think through how do we engage, how do we ensure there's country ownership? How do we ensure we're engaging the correct voices? And so, yeah, I absolutely agree that I think we ourselves acknowledge that it wasn't a perfect process. But yeah, the unfortunate reality is we are in this new world where we're not even part of the conversation.
What's the one thing you hope, though, from this conversation that listeners remember?
Yeah, I think, well, first, I do want to thank you for providing this space to allow each of us to tell the story. I think you creating that space is really helpful. And two, I think the thing that I would love for Americans to understand is that foreign aid is a nuanced space. And I know a lot has been said, sort of villainizing the work, talking about waste and corruption and talking about the people that did it in a negative way. But it was a nuanced approach. And I hope we've covered some of that today in that foreign aid, particularly global health security, is intended to support host governments, to support people in other countries to be safe and secure, but it is also intended for Americans to be safe and secure. It is also intended that American businesses are advancing, our overall diplomatic and national security interests are advancing. So I think, one of the things we need to do is start having more nuanced discussions around it. And I would love for us to have additional discussions around how do we redefine global health in this new era. I'd love to see private sector and philanthropic organizations start to step in to address some of those immediate funding gaps while we redefine and redesign the future of global health. So I would love to see those two things happening here. And, particularly in the countries where we work, I think we're already seeing this, but there's been significant discussion about, social ventures and how do those social ventures step in and solve local issues. There is significant discussion already happening about how do the governments of those countries now start to finance and build in additional budget to address some of the gaps in their system. Now, there's no way, in the short term, other governments can very quickly fill the funding gap that we were providing. So a lot more discussion needs to happen there. But I'd love to kind of see more people get engaged in this discussion because it is really important. And it just seems like it's getting swept under the rug.
It's almost like here we are and there was an incredible loss, the U.S. pulling out, and we saw immediate effects of that. And there has been this groundswell of local entities in different countries talking about what they need to be doing. We see philanthropies thinking about how they can invest and improve. And that's all sort of for the immediate. And in the long term, I wonder for the U.S., it is not so much how do we build back better, but how do we begin to dialogue with a new system that might be emerging?
Yeah, absolutely. And I think all of that is to be seen. And, I think we'll have to look to the administration to see, how they would like the next steps they would like to take. But I also hope that we as private citizens and our private sector and philanthropic organizations are also ready and engaged to dive in this new model.
All right, Ashna, thank you so much for joining. We have talked about so many different things. I am thinking about everything in a way different way, especially like what chicken I'm eating and where is it coming from. So thank you.
Yeah, absolutely. Thank you for having me. It's been a pleasure talking to you and really appreciate the platform to be able to talk a little bit more about our work and talk a little bit more about what brought me to the development space and, happy to always share the gospel of health security.
Enjoyed the episode? Hit follow, leave a quick review, and subscribe to Global Development Interrupted on Substack for more stories like this delivered right to your inbox.